Hello lovelies, and welcome to today's video. My name's Alya and I'm so glad you stopped by. Today we're talking about COVID's effect on the eyes. Hope you stick around to learn more. I've been really fortunate in Melbourne because, well, fortunately unfortunate, because we've been locked down for so long that we haven't really seen this huge COVID situation like the rest of the world. We've just been spared in a lot of ways because it just didn't get through the community. I guess that was the whole concept of lockdown, is that it wasn't going to spread around. But unfortunately it's here and it's absolutely everywhere. A lot of my friends have recently become unwell, and look, I just really hope that this is the lighter cases, but unfortunately around the world a lot of people have experienced a lot of different symptoms, some severe, some very mild, and the eyes have not been spared, that's for sure. What happens during any kind of severe viral infection, whether it be flu or whether it be COVID or whether it be just even your common cold, is that the eyes can absolutely become involved. And the way they become involved is very similarly to the rest of the body, where you experience some very interesting inflammation. When we describe inflammation, we call it an itis. So you can hear terms like conjunctivitis, uveitis, retinitis, optic neuritis. All these terms just refer to the part of the eye or the part of the body that is involved, and itis just says that it's being inflamed. So for example, dermatitis, your derma is your skin. Any kind of inflammation of your skin is dermatitis. So that's all it is. It's not really all that complicated in terms of the language. Even though we use all these big terms, they can be broken down really simply to then refer back to what is being affected. So I had a really good look around all my Google to see what kind of statistics are coming up with eye problems. Now I would suggest that because the eye issues are coming on at a stage where breathing and survival are probably the priority, and this happens across the board with eye problems. A lot of the time people have to choose to neglect their eyes because they've got much more life-threatening problems to deal with, and that's absolutely understandable. There is a increase in eye problems being reported, especially in the early stages of COVID. And when we were first sort of learning about this disease, we were sort of more cautious than usual about treating people with conjunctivitis, especially because we knew that it's one of the symptoms. But the reality was, until recently, is that we didn't really have much COVID in the community. There were certainly cases out there, but it wasn't really in our backyard. So we were able to avoid it really easily, I guess you can say. But we definitely do see a lot of conjunctivitis. We definitely do see cases of uveitis. We definitely have seen cases of optic neuritis and retinitis in the clinic for various reasons. Luckily for us, it hasn't yet been linked to any cases of COVID, but I'm very conscious of the fact that now it is in our backyard. Now there are a lot of cases in my specific area, and it could just be a matter of time. But luckily we're at the stage now where most people are protected, and it shouldn't hopefully be anything too bad for us. I definitely do feel for the people who experienced all this, and the clinics who experienced all this early in the picture, where there were no real medical options of how to go about it, except for treating the symptoms and just being reactive about the treatment. I just want to quickly brush on the different types of itises that the eye can have. The main kind of inflammation that people are very familiar with is conjunctivitis. So pink eye, it can be viral, it can be bacterial, it can be allergic. So it's not just because you have a pink eye that you definitely have COVID or anything like that. God forbid, that's not how it works at all. You can have a red eye for so many reasons, like the shampoo got in, or just irritations, things like that. So there's absolutely no hard and fast rule that all conjunctivitis will definitely be a sign of some sort of respiratory disease or anything like that. No, but it's just one of the signs. And the reason that the conjunctiva, the sort of clear sheath that sits on top of our eyes and provides a whole bunch of cells to our eyes, which are really necessary, the reason that that can get inflamed and infected very easily is because it's our protective structure. So the lids can often get swollen as well, blepharitis in that particular case, but we still refer to the conjunctivitis part of things because that's what we're going to treat. And a lot of the time it just means that we just have to get rid of some of that inflammation and lubricate the hell out of that eye. A lot of the time is what we do. The reason being is that the eye is really good at dealing with its own stuff, as long as it's not bacterial, as long as it's something quite common. That's why you have such a watery eye. It's just trying to flush out its own system there, kind of trying to clean itself. So we do things to help it along the way. So things like steroid drops are very commonly prescribed to help with inflammation, and of course lubricant to flush everything out and make the eye more comfortable. Very important, because a lot of the time people are sort of embarrassed, or they don't think it's that concerning that their eyes are feeling uncomfortable, because, well, it's just comfort, right? But the reality is that when you're uncomfortable, when you feel like there's sand in your eyes, when the eyes are scratchy, that's also a sign that they're in distress. So you definitely want to relieve some of that distress to help the eyes along the way of their healing. So there's nothing wrong by saying my eyes are just sore. Sore eyes is an absolutely valid symptom, and there's no reason why that shouldn't be a valid thing to treat. Because if you don't sort of hop onto all the symptoms, you may not get a good outcome. So sometimes with any conjunctivitis, even one that comes from having the common cold, or just a sinusitis or a rhinitis, or just when you have a runny nose or a swollen sinus and you get conjunctivitis in relation to that and you didn't report it, you didn't treat it, what can happen is you can end up with a chronic dry eye for a period of time, and they're a little bit harder to overcome, a little bit harder to treat, and a little bit hard to get rid of the symptoms then. And it can be quite disruptive. Like, it can actually affect your vision, not in terms of, your vision disappears, but it can definitely make it blurry, uncomfortable, cause eye strain, headaches. And then you go off and buy new glasses and get all onto this journey of trying to fix the symptom when all you really needed was some really good and very regular lubricant. But that's just the, so to speak, scratching the surface, literally the surface of the eye. The next thing we need to always, and I usually check, let's just say I check most patients for this, is optic neuritis. Now, it's something that happens more often in things like, chronic issues like MS, for example. But you definitely want to screen any patient that's reporting any unusual eye symptoms. And it's very easy to do. It's just a red saturation. Because when the optic nerve becomes inflamed, a lot of the time color saturation drops. And there's plenty of red stuff in the clinic to refer to. So I often just grab a red lid and sort of say, all right, is this eye experiencing, how do you see this red? Is it 10 out of 10? Okay, what about the other eye? Oh no, it's a bit duller. It looks a bit grayer. It's a 7 out of 10. Then I start worrying and I start doing things like scans of the back of the eye. Now, I've heard here on YouTube, some doctors refer to them as ultrasounds. Please be aware that these are not ultrasounds. I don't know why that's important to me, but they're not ultrasounds. They're actually really complicated photography. We do also do ultrasounds of the eye, and they're different. This is very, very high resolution, high detail, very, very, very sort of forward-thinking photography. And it does actually produce a result very similar to the kind of ultrasounds you see pregnant women get, for example. So that's the kind of outcome you get, but the technology is actually photography, which means that we can be so much more specific, and it's just a better tech. And because the eye has a big old hole in the middle of the pupil, we have really great access to doing a really, really detailed exam of that area. So I can measure all the layers of the optic nerve, looking for any kind of inflammation back there. Obviously, if you're worried about inflammation at the back of the eye where the nerve is, you're going to also search for retinitis. So any kind of vascular inflammation, any kind of signs of things that just don't belong at the back of the eye there. It's a very interesting space. Oftentimes you'll see things like that in sort of maybe a diabetes or something like that, or a high blood pressure. That's another really common one. But what I've found is that, if your body's in distress, there is a very good chance that your blood pressure did go up. Even if that's not necessarily directly an eye problem, obviously you treat the blood pressure at that particular stage, because that is the problem. Because it's affecting the eye, that is something that will then down the track need to be monitored, and you'll need your ophthalmologist to make sure that that has resolved. We have in many occasions actually diagnosed things like cholesterol and high blood pressure episodes in patients that had no idea that they were experiencing them. Because these are things that often don't show up on your blood tests at your GP, because they can come and go. But the eye has a bit of a long memory. It tends to cling on to things. So if you've had some high blood pressure, it tends to, and one that has affected your eye, it tends to stay there. It doesn't then resolve. The eye is not in any danger, but the signs that you had an episode kind of just stick around. Especially someone who's had like a heart attack or quite a severe high blood pressure, the eye can easily become affected. It doesn't always happen, but it definitely can. So am I worried about experiencing COVID at the clinic? Look, to be honest, I haven't been at all worried about it until more recently. I know people directly now that have COVID, and it worries the absolute life out of me. It really does. Not because I think that they're going to be unwell I'm not worried for their lives necessarily, but I am worried for their long-term well-being. And I'm definitely worried about the fact that because this is such a contagious disease, you're not going to leave home unless you're going to the hospital to do anything about it. So my concern is what other adjacent problems are not being attended to. So I mean like the eye symptoms, I mean like potential, I don't know, other body symptoms that definitely need attending to, but they're not a priority, because if you are seeking medical help with COVID, you are not going to be worried about a pink eye. You're going to be worried about breathing. You're going to be worried about your heart. You're not going to be worried about organs that aren't necessarily life-threatening problems. And it would be interesting to know later down the line, how many eye problems were experienced in, emergency rooms and things like that, because I doubt very much that they have the capacity to attend to such non-emergent problems. The funny thing is that the Eye and Ear Hospital here in Melbourne definitely does see conjunctivitis as an emergency, because it can be quite painful, it can be quite severe. But I'll say it's spooky. It's spooky to have a sore red eye. So people do report to emergency all the time with a sore red eye. We see it in a private clinic too. So if that's happening, my sort of interest is at which stage of COVID is it happening, and how many people are reporting as their red eye or their conjunctivitis or whatever it is, their sore eye, their blurred vision, whatever the case may be, as their primary symptom with COVID. It would just be fascinating one day to look back on all of this 18 months that have been happening around the world and sort of seeing, what kind of medical statistics we can learn from this and how we can be better prepared for future issues that break out around the world. This is a massive opportunity for medicine to get better and smarter and much more prepared. And I really do hope that the powers that be definitely use this opportunity to improve what they do and do it much better. My lovelies, I hope you enjoyed today's video and my little quick look that I've got for work today. If you like this video, please don't forget to like and don't forget to subscribe. And way more going up on Instagram. I'm definitely getting back into this whole uploading business because I've had a little bit of a break, but I'm so happy to be back. Looking forward to more videos next week, and I can't wait to see you on that one. Bye.